Welcome to This Week in Health IT. It's Newsday. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Special thanks to Sirius Healthcare, Health Lyrics, and Worldwide Technology, who are our Newsday show sponsors, for investing in our mission to develop the next generation of health IT leaders. We set a goal for our show, and one of those goals for this year is to grow our YouTube followers. We have about 600 plus followers today on our YouTube channel. Why, you might ask? Because not only do we produce this show in video format, but we also produce 4 short video clips from each show that we do. If you subscribe, you'll be notified when they go live. We produce those clips just for you, the busy health IT professional. So go ahead and check that out. We also launched Today in Health IT, a weekday daily show that is on todayinhealthit.com. We look at one story each day and try to keep it to about 10 minutes or less, so it's really digestible. This is a great way for you to stay current. It's a great way for your team to stay current. In fact, if I were a CIO today, I would have all my staff listening to Today in Health IT so we could discuss it. Agree with the content, disagree with the content. It is still a great way to get the conversation started, so check that out as well. I ran into someone and they were asking me about my show. They are a new master's in health administration student, and we started having a conversation, and I said, we've recorded about 350 of these shows, and he was shocked. He asked me who I'd spoken with, and I said, just CEOs of Providence and of Jefferson Health and CIOs from Cedars-Sinai, Mayo Clinic, Cleveland Clinic, and just all these phenomenal organizations, all this phenomenal content. And he was just dumbfounded. He's like, I don't know how I'm going to find time to listen to all these episodes. I have so much to learn. And that was such an exciting moment for me to have that conversation with somebody, to realize we have built up such a great amount of content that you can learn from and your team can learn from. And we did the COVID series. We did so many great things, talked to so many brilliant people who are actively working in healthcare, in health IT, addressing the biggest challenges that we have to face. We have all of those out on our website, obviously, and we put a search in there, makes it very easy to find things. All the stuff is curated really well. All right, it's Newsday, and we have Drex DeFord in the house once again. Drex, welcome back to the show.
Hey, thanks. Happy to be here. Always a good time. Thanks for having me.
Yeah, I'm looking forward to this. We've got a lot of interesting topics. We'll talk a little bit about conferences because we just finished the CHIME conference. I actually snuck out a little bit today, went to the Health Evolution Forum town hall that they had. I thought that was really interesting. I got to hear from some leaders and what they're doing in that space. And that was interesting as well. We have CHIME coming up. Gosh, we got Vive. We got a lot of stuff to talk about with regard to conferences and what works, what doesn't. We've got some CMS stuff. You actually posted something. I think it was you. It may have been the security guy from SCL Health, whose name I can't remember. Howard? No, I have his name wrong. Anyway, I hate doing that on the show because now he knows that I got his name wrong.
But we do follow him on LinkedIn, though. We do.
Talking about the FBI security thing, how the FBI went in and got the shell and stuff. So anyway, all right.
I might have posted that too. So
yeah. All right. So we're gonna talk about that, and we'll also talk about Biden outlines health IT funding priorities going into next year. So I've outlined that. We've got a lot to talk about. But let's start with where we're at. Let's talk about CHIME. You just finished 2 days of sitting in the dunking booth, waiting for people to come in. And if people wondering what I'm talking about, you actually manned the session as one of the Zoom people that they could talk to if they went to the CrowdStrike booth.
Sweet.
So you were sitting there waiting for, let's talk overall. I mean, this is their second virtual conference. We did the fall forum. Now we did the spring forum virtual. What have we learned? What are we seeing?
I think there's a part of me that is like, they're getting better, and not just CHIME, but just sort of conferences in general. I just did the American College Healthcare Executives college, forum virtually too. They're all a little bit different. They're using different tools, but I think they're getting a little bit better over time. And in a conversation with somebody else, either they said or I said something to the effect of, hopefully by the time we have this all figured out, we won't need to actually use any of it anymore. And I know that we can talk about that too. Right?
Yeah, it is getting better. I agree with you. They're all getting better, and it's really interesting. But they leave you wanting, don't they? You're like,
well, I think there's a couple of different pieces of this. One is the tools have gotten better, and the other part of this is we have lowered our expectations about what we're necessarily, maybe going to get from the conference, and we've gotten better at navigating the tools ourselves. And so, they're not perfect. They're not live conferences. A lot of the reason that I go to the HAMS annual conference or Health or CHIME or ACHE is for the social interaction that goes on, not
right.
necessarily for the presentations, but for the actual sit down and hear people, misery loves company, talk about what they're working on and what they're challenged with and what we're struggling with, and trading, ideas. And then sometimes, you just develop friendships over years and years and years. Sometimes this is about trading barbs and beers, and all that's good too. And all that is missing from the online format.
Did you get a chance to take in some of the center stage stuff?
I did.
There were keynotes. What were they? They were really roundtables.
Yeah, I thought they were. I thought they were good too. This idea, of CHIME, I think, of moving from big expensive commercial keynote speakers who are really entertaining and can be a lot of fun to watch, and at least online, making that transition to more practically oriented folks who are in the field, folks who are in the trenches, how they're solving problems, the things that they're up against. A good, interesting transition, and I think really useful.
All right, so yeah, a bunch of really good moderators, all former guests of the show. So Karina Edwards was there, and Andrew Rosenberg from Michigan was there, Daniel Barchi and Darren Dorkin. So all former guests of the show. So we won't say anything positive or negative about them, although they're all phenomenal.
Fantastic.
Yeah, they did a good job of moderating. Did you learn anything? So the first session was the EHR providers. It was Meditech, Epic, and Cerner up on stage. You learn anything exciting you walked away from there? Yes, but that's putting you on the spot, isn't it?
But I mean, it's hard, right? I mean, we've been doing this for so long, and we keep such a close eye on those companies and what they're doing, that it's hard to have any big reveal at a conference like this, unless they intentionally put something in place to try to have a big reveal. So, honestly, no, I don't think I walked away with like new or special information, but it's interesting to hear them talk about their company's challenges as they went through the pandemic, and what, how they leveraged the work that they did, or how they're leveraging the work that they did to prioritize and accelerate work that they're going to do in the future. That's all real good. That, and Howard Messing needs a better light. That was the other thing that I really got. He's kind of dark in the dark. So, but that would be the only other thing I would say.
I'm actually putting a little bit more of an edge to my reporting and my posts and that kind of stuff. And I'm calling out some stuff. And one of the things I'm going to start calling out is we are a self-congratulatory lot. Now, I understand the work we do is hard, and we've done some great things. And I agree with all those things. But gosh, we spend an awful lot of time self-congratulating ourselves for what we've accomplished. And I'd like to see, not that I don't think we should do that. We should absolutely do that. We should have a CIO of the year. We should applaud the most wired. We should do those things. Those are accomplishments. But I think we need to spend a little more time saying, hey, where are we not making the grade? Where are we not hitting the mark? Where are we not providing our consumers what they want? It's interesting because I have some people that work for me now on This Week in Health IT. I'm not a one-man shop anymore, and they listen to every podcast. And there are times they listen to the podcast and they get angry, and they just say, I don't know how these people think that the consumer experience is any good. This was my experience. And they send me over this email, and I'm like, no. But the reality is we've all had those experiences. And when we hear the self-congratulatory stuff, we're like, you do realize we have a long, long way to go here before we are the experience makers that we really want to be.
Yeah. I mean, it is perspective. Most of us who work in healthcare, when we go to get healthcare, we have special access just based on people that we know who can help us figure out how to get appointments and help us navigate. I got this bill. Can you help me figure it out? The rest of the normal population don't have that kind of access. So we kind of unfortunately start from that position. And, I'm with you. We have to celebrate our small wins and our incremental progress. But I think we have to do it in the context of, like you said, we have a long way to go. We are not consumer-based delivery healthcare systems for the most part yet. There's a lot of work to do to get to the point that people are as happy with us as they are with Amazon Prime.
Yeah, and I'm pretty happy with Amazon Prime at this point. I mean, they do a great job. So I don't want to go down this path too far because I don't want to sound like I'm being negative. They did a great job with the conference. I would have liked to pick up more. How are we going to adjust? How are we going to get better and those kind of things? Again, I thought the questions were great. Daniel really went after the big tech companies, which was interesting because I thought Darren didn't go after the EHR companies at all. It was such a friendly little gathering. And then big tech came out and it felt like Daniel went after them. I'm like, that's interesting. We treated them like, the grandparents came over and we love you. Thanks for coming to our stage. And then big tech came and we treated them like, like party crashers. And,
I was wondering, I was like, okay, where's this going?
Yeah.
Who's the other? Grandma and grandpa and party crashers.
Party crashers. I mean, it's like, hey, you guys, are you going to help us or you're not going to help us? And if you're going to help us, it has to look like this. And Dana was just right in their face of, hey, are you going to work together? Or you're not going to work together. If you're not going to work together, this isn't going to work because I can't work with just one of you. I need to work with all three of you because I have a Microsoft agreement. I need to put my stuff in Google's cloud. I need to use AWS for some things. And if the three of you can't even agree, I think the exact quote was something along the lines of, if the three of you can't even agree on a time where you can come together and do a video call, how am I going to get you to work together for my health system? That was the point which I was like, ooh, boy, that was pretty sharp. Anyway, that was my 2 cents. Hey, so conferences, we want to get back together. When is too soon? So one of the articles out there is some healthcare associations moving full steam ahead with conferences starting this summer. Interesting, different approaches here. The Federation of American Hospitals is going to get together in Nashville, but it's going to be a smaller group. The HIMSS obviously is trying to go full steam ahead. HFMA has decided to push back even further. So they're not doing their event, I think, until either late this year or early next year. But, the HIMSS event's right around the corner. I think it's
August.
Yeah, it's August. So, I mean, it feels like it's just right around the corner. So do you feel like, they will probably be the first large event that tries to come back. Do you think they're pushing it? Think they're going a little too early or think that's the right time frame?
There's so many indicators that I watch all the time about this. I have my first Pfizer vaccine in. I get my next one on the 29th. Give that another 30 days. I'm in June. I'm vaccinated and I have all the antibodies built up. But I realize that's not most of the country. And so as we continue to sort of watch 30% of the country's vaccinated and we're vaccinating, I don't know, some percent every week. The math says we ought to be at the point where we probably have everybody vaccinated who wants to be vaccinated maybe by July, something like that, unless we have some kind of a problem with a vaccine, which we see right now with Johnson & Johnson. And so now we're holding up the show. Now, how many of those doses would be in arms if they weren't held up? So it's a very tenuous thing, right? And it concerns me a little bit about trying to walk the tightrope of, okay, let's do it in August when maybe July is the time when everybody is maybe finally vaccinated, but it only takes one oops to make that, 2 months later or a month later. So I'm skeptical. I'm kind of like it would be better if maybe we waited a little bit longer, but I'm sure there's a lot of other pressures around all of this that, that make August a reasonable date.
My question is, who else is going? Because the mortality rate in my age group is less than 4% since the beginning of the pandemic to now, and I'm in an older group. Actually, it's closer to 2% actually in my age group, and so that doesn't concern me. I have my first dose of the vaccine. I'm going to get another one. I've seen the stories where people who have gotten the vaccine also get COVID, but the numbers are so minuscule that it's within the range that they tell you is the risk that you could get the vaccine and still get it. And so I think the risk is low enough that I feel safe going. The risk, even if I get it, is not, it's an acceptable risk. I'm going to have more risk driving to the airport and driving in, Vegas traffic. Than I am really, am I going to get after I'm vaccinated and I'm wearing a mask, actually getting COVID and then being one of the 2% that actually is a fatality from it. So I'll feel safe. Why go if you're not going to go, and why go if the people I want to see aren't going to go?
Yeah, I think my concern is probably more of the larger public health concern. I'm not a public health guy, but I do worry about the variants, and I do realize. I mean, it sounds like right now that as variants continue to proliferate, they're for the most part handled by the vaccines that we have today, but it probably takes, one or two weird variants that aren't handled by the vaccines that we have today. And we're back at the beginning of this whole cycle again. And the way we get more variants is that people aren't vaccinated and they're out trading around the virus, and the virus continues to adapt and generate these variants. So in the larger sense, the reason not to go might be, just keep your powder dry for another few months, and we are able to sort of wipe out all the variants too. It may be about personal safety for a lot of people. I think it is. I certainly think that by August, given my vaccine status, I'll probably feel much more safe about traveling. But I may not travel because I worry about this larger public health potential challenges out there.
Yeah, I was trying to pull up so I covered this on Today in Health IT on Friday. Of course, we're doing this on Thursday, so the show will go live tomorrow morning. But it's the most recent HHS statistics and those kind of things. The numbers are actually pretty encouraging, except for I think it was Kaiser Health News. There it is. There's the report. So Kaiser Health News came out with a study that essentially is looking at this and saying, look, we're probably going to end up at roughly 60 to 70% of the population getting vaccinated. It looks like about 20% are just not going to get in line. And then there's a portion that are just not going to get vaccinated, either from an access standpoint or some other reasons that are there. So and they're talking about, herd immunity somewhere in the upper 80s is what they're looking at. So we are going to go into next year and for the foreseeable future where some portion of the population is not going to be vaccinated. And then we're going to run into this thing of, if this is an every year thing and we look at the flu vaccination rates, we've got some challenges in front of us in terms of feeling 100% safe. And this is part of my concern, and is I don't think we're ever going to feel 100% safe.
Yeah.
How are we going to get back to, functioning? This isn't really where I wanted to go with the show, but when we talk about these conferences and I'm looking at a picture of all these people milling through the HIMSS floor, and we all know what that's like. Yeah, you're not going to feel safe. There's no way you're going to feel safe in that environment. So they're going to have to redo the showroom floor differently. They can't possibly have, 40, 50, 60,000 people in that room. So, what does it look like? They've got to really rethink. And I don't think one of the things this article talks about is they haven't published what their safety protocols are going to be. And I think that's going to be a limiting factor. HIMSS could be in trouble if they don't get ahead of this safety aspect, just from the conversation you and I just had.
Yeah. No, I mean, I think the even after everybody's vaccinated, 70%, let's just say 70% of the people decide to get their vaccination. There's some other percentage beyond 70% that already had COVID and have some sort of natural immunity. So maybe we can get to 80%. But when it comes to conferences like this, the new normal, to overuse a term, might be that we're still going to, wear masks in situations where we can't social distance. And, we're going to spend a lot more time thinking about washing our hands and what we touch and what we don't touch, and shaking hands or bumping elbows instead of shaking hands, all the kinds of things that we've learned to do in the last year that probably are pretty good for public health in general anyway. Absolutely. Like, if you're not washing your hands and sort of keeping your social distance from people that you don't know or aren't in your core group, you probably should be doing that anyway. I mean, you're probably just generally going to stay healthier because of that. So maybe we've developed some habits now that are going to go on and are going to be good for us. And
we'll see.
I do worry about HIMSS. Yeah.
So if anybody's listening from HIMSS, here's the reality is, if you have 50,000 people there, it means 10,000 are not going to be vaccinated. And if 10,000 people aren't vaccinated, I doubt you're going to have 50,000 people there. So
you got to tell us the protocols. You got to tell us what you're doing, how you're changing what we have in our head as the vendor floor and the conference rooms. How are you doing that differently so that we can feel comfortable telling our company we should go and they should pay for it?
And there are still companies that have travel bans on. And I'm like, okay. So there's whole health systems that aren't going to be sending their team to this event. They can't afford to send their team to this event from a risk standpoint. And so anyway, we'll move on from there. Hopefully somebody from HIMSS is listening. They're going to come out with their safety protocols and we'll figure it out. To be honest with you, I've not decided whether I'm going yet or not. So I'm going to continue to have conversations, find out who's going. If enough people are going, then I will probably end up going. CMS. So CMS issues new guidance to enforce price transparency. Did you see this one?
Yeah. It's interesting. Don't hide your pricing from search engines.
Yes. So they've hidden it from us, right? I've heard this from people. It's like, you go out to the site and you're supposed to be able to find this and it's impossible to find. But, regardless if they hide it from us or not, they can't hide it from big tech. They can't hide it from Bing, from Google, from all the search engines that are out there, which means that they're going to pull it up. And if you know anything about Google, their strategy is that if you ask a question on the front page in the box, that it tries to give answers. And so there could come a time where you just go to Google, type in, hey, where's the lowest price for a colonoscopy? And it pulls it up because CMS is going to go after health systems that put the no search function on there. You think this is a good thing?
So I know. I don't know if you follow Dan Munro on Twitter, and have you ever had Dan Munro on as a guest?
I have not.
He's a great, writer for Forbes and others, and he's written a book called Casino Healthcare. And it's, if you talk to Dan about this, he would probably say, I don't know that it really matters. Do you care what the price is of the colonoscopy that you're going to get if your insurance company is paying for it and telling you that you can only go to one of these 4 places anyway? Would you look at pricing to decide?
Do you know what the answer to that is?
Yes.
Yeah. Do you know why I care?
Why?
Because I'm an employer. That's why I care. Because I'm paying for that insurance. I pay 100% of the insurance cost for my employees. Yeah. I am paying for that. So next year, when my fees go up, my costs go up because people aren't being discretionary in terms of their healthcare spending. Yes, I do care. I think it is a problem that there's a $20,000 colonoscopy when the average is like $3,500.
Yeah, no, I totally get it. But I think Dan would be able to point you to a lot of sources that say that for the most part, if they knew the prices, most consumers would not change what they're doing as far as their behavior. And so this may be some kind of an okay start to trying to figure out how to influence consumer behavior. But this may not be the thing that influences consumer behavior. We're burning a lot of, we're creating a lot of heat and smoke around this issue, but I don't know if we're, too many analogies, but is the juice worth the squeeze? Is it really going to have the effect that we want? So we'll see. But, mostly out of curiosity, I might look around and see where the lowest price colonoscopy is, but I'm probably going to the colonoscopy shop that is covered by my insurance.
Well, here, let me point out your inconsistency, which is,
okay,
you believe transparency is good in government.
Yeah.
Absolutely. Do you believe transparency is good when you go to buy anything, buy a lawnmower?
Yeah. If I have a broad range of choices, then price is definitely one of the things that influences where I go to buy. Because
transparency communicates trust. I trust you to make the right decision. And the problem with healthcare is we are arrogant, and we believe that the consumer doesn't know enough about health to make the right decision. And instead of informing them, we care for them. We care for them by keeping information from them. We care for them by not informing them. That's one of the challenges we have. We need to change the mindset. And the mindset needs to be, you know what? We trust them to make the right decisions. And if they make the wrong decisions, there are safeguards. We're going to inform them. We're going to say, are you sure you want to do this? There might be a better procedure here. You may want to stay in your own community, whatever it is. But at the end of the day, it's their decision and we trust them. Therefore, we're going to give them the pricing. We're going to give them the quality scores down to the doctor level so that they know that the doctor they're seeing is, it is not as good as the doctor who's, down the street and around the corner that they could just as easily have gone to.
Sure. You said something really important there, and that's trust. I definitely trust the advice of a friend of mine who had their hip replaced that told me that these guys at this organization were, probably they were really good. They had a really good experience there, and they thought they did a good job. And then I looked up the doctor's scores, the quality scores, and I was like, okay, this is pretty good. I like this particular surgeon. Let's see if they're in my group of people that I can be referred to. And I found out that they were, and that's who I went to. But I never looked at pricing. That had nothing to do with trust for me. I knew I was probably going to have a copay. I mean, I'm lucky, right? I have insurance. I knew I was going to have some kind of a copay, but the copay didn't change if I went to Dr. A or Dr. B or Dr. C or Dr. D. It really didn't. Now, what the insurance company had to pay may be wildly different pricing, and that may be the information that's exposed. And I may get aggravated by looking at that pricing and saying, how can it be $20,000 there and $5,000 there? But I don't know that it would have changed my mind once I've sort of figured out that this doctor is the doctor that has the quality that's been recommended by a friend. And so I trust that that's probably the best place for me to go. I wonder if it's more of a wall of shame issue than it is a, influencing patients to go to a particular doctor based on price.
Yeah, I keep coming back to trust. There's part of it that's like, what are you hiding? What are you hiding that I don't know what it's going to cost me every time I go to the doctor? What are you hiding?
Oh, for sure.
And
Now,
so,
I'll tell you, I think from a transparency perspective, absolutely pricing should be transparent. I just don't know if it's going to have the influence that we're expecting it to have. But generally speaking, shining a light into the darkness on any of these issues is a good thing. It's a good thing because it makes healthcare systems also do things that they're not comfortable with, like cost accounting and really figuring out what things actually cost instead of just saying, we have a facility charge and we just put it on top of all the things that, every time we treat a patient, we just chunk on this, a facility charge, and it's just a big number because we aren't good at cost accounting. Well, maybe we have to get better at that now. And if we do, and we're able to figure out pricing, then I think that's a good thing.
Yeah, because one of the problems in healthcare is, we learn this in economics, it's called elasticity of demand. And typically what happens is when you increase pricing, the demand goes down. And when you decrease pricing, the demand goes up. And the reality is in healthcare, there is no elasticity. You could raise the price forever, then we're still going to go to that hospital.
That's
and you
right.
could lower the price and it's not going to increase. So it doesn't respond to the
Normal market demands.
Yeah, the market dynamics. And so, to a certain extent, it's not going to change behavior all that much, but it does become a source of trust, a source of, I don't know, communication and those kind of things. Let's, gosh, which one do we want to talk about next? Let's talk about your security one. I think that's interesting too, because that's a trust question.
It is interesting.
Yeah. So what was that about? So the FBI was responding to a threat, I guess.
Right. Do you have the story in front of you?
I don't.
Okay.
So this is dangerous territory for us.
Definitely. Well, the FBI apparently went out and, without getting into the kind of nitty gritty technical details, the FBI got a warrant to be able to go out and go into organizations and do some partial cleanup of breaches that had happened, to take particular actions in a network to at least partially resolve some of the issues that were in these networks. And so part of this was the, sort of uncomfortable feeling of like, I've been breached, and then the government actually used the information about how I've been breached to come in and do a partial cleanup. But they didn't fix everything. They just removed this particular piece of malware. And I don't know. I'm not sure it feels right. I'm from the government. I'm here to help. And just a little bit.
That's what you said. I just pulled it up. It is Howard. It's Howard Haley, who's the CISO for SCL Health. And he put this: FBI nuked web shells from hacked Exchange servers without telling owners, which is interesting in and of itself. And I think that's sort of the gist of it. It's not, the FBI looked at it and said, look, these organizations didn't have the skills, and which was probably accurate. They probably
But
didn't.
How do they know that? I mean, how do they know that? And then the other thing I wonder about is if you go in and you remove that, those web shells, if you go in and do that work, has somehow that organization now lost evidence that they would like to know as part of their investigation around the hack themselves? This is a really interesting to me, like how did this happen? I would be upset if my organization were one of those organizations because, I don't know how.
I'll tell you.
How do they know I wouldn't have taken care of it? From a transparency perspective, I would at least have appreciated a phone call saying that we're going to do this. Are you okay with it?
I agree with you. I'm like, something doesn't feel right about this. So in a Department of Justice press release published today, the FBI states they used a search warrant to access the still compromised Exchange servers, copy the web shell as evidence, and then remove the web shell from the server. The FBI requested this warrant because they believe that the owners of the still compromised web servers did not have the technical ability to remove them on their own, and that the shells pose a significant risk to the victim. Based on my training and experience, most of these victims are unlikely to remove the remaining web shells, so forth, it goes on to say. But I think a little later on it says, hey, the reason they didn't tell them is because they thought they might essentially interfere with this work and it was too critical. In other words, they didn't want to risk being told no. Yeah. So they just did it. And
look,
we need policy and ethics people to be working like triple time these days. There's so many new things coming at us.
Yeah. I think that in this story, there's some top secret. There's some piece of this story that we don't know and we don't understand that might make us also now. I mean, as I say here and sort of think about it again, there might be some piece of this that makes us, if we knew that part of the story, we might go, oh man, okay, that totally makes sense. So I wonder if there's some piece of intel that we don't have that makes this feel not right. But if we knew the other piece of intel, we might say, I'm glad they did it. I just don't know. It feels uncomfortable knowing what I know.
Yeah, well, I wouldn't want to come home after a week gone and have a little note on my door that says, "Hey, FBI was in your house for a couple of days. We, just thought we'd take care of some things. I don't know. There's just part of me that was, I don't know. I don't know. I don't even know what I'm saying. I guess there's policy and there's ethics. And I really, I want them weighing in on this stuff. I want them, the cybersecurity stuff is going to create some interesting things. Data privacy is becoming more and more acute within healthcare. What are you doing with my data? Where are you using it? Who's using it? There's an awful lot of things that we could use people coming out of our colleges and universities who are working on ethics and really focusing on the ethics aspects of it instead of the politics aspect of it, not coming out trained in a certain way of thinking, but coming out and looking at it from the different perspectives that are out there. What does this mean to the individual? What does this mean to the rights of the individual? What does this mean to the rights of the whole, the group, right? So some of this stuff might impact more than just me and my organization, might impact others. And maybe that's why they did that work. You might be right. There might be some piece of information we look at and go, yep, that was the right move.
Yeah.
I just want to know that they're following a framework of some kind.
Right. And some of this is, do you trust that whatever the reason was that the judge gave them permission to do this? Maybe, certainly that's the role of judges in granting these kinds of actions, is that, they get a brief that if we looked at it, 80% of it would be redacted. There's something else in this story that I think we don't know.
Yeah.
But like I said, based on what I know, I'm with you. I would not want to come home and find out that the FBI had gone through my house and done something, but they didn't ask me permission. There's something not right, but there's something absolutely right. I don't know which.
It's always fun for you and I to talk about such things. So Biden outlines health IT funding priorities. Always a good topic for us. The Biden administration this past Friday released a letter outlining President Joe Biden's request for fiscal year 2022 discretionary funding in advance of Congress's annual appropriations and budget process. The consequences, anyway, they go on to talk about some stuff. I'll skip that and just get down to what they are. The additional funding would go towards modernizing public health, data collection nationwide, in addition to supporting core public health capacity improvements in states and territories, training new epidemiologists and other public health experts, and building international capacity to detect, prepare for, and respond to emerging global threats, according to the letter. So let me give you some of the numbers. 153 million would go towards the CDC's social determinants of health program to support the states and territories in improving health equity and data collection for vulnerable populations. 6.5 billion would go towards Advanced Research Projects Agency, ARPA, for health, a new agency, ARPA for health, aimed at driving transformative innovation in health research and speeding implementation of health breakthroughs. In addition, the request would provide 65 million to 2021 enacted level of rural e-connectivity program, Reconnect, for rural broadband, which we have talked about. The wish list also includes 39 million for advanced communication research at a National Telecommunications and Information Administration, which would support the development and deployment of broadband and 5G technologies by identifying innovative approaches to spectrum sharing. Interesting.
Sounds infrastructure-y to me.
Million would go towards expanding scientific and technology research. 2.1 billion for cybersecurity and infrastructure security agency. 20 million for new cyber response and recovery fund. 500 million for technology modernization fund. And let's see, 4.8 billion for VA. 2.7 billion of which 2.7 billion is going to the modernization of the electronic health record for the VA. Yeah. I think that
Cerner upgrade.
Yeah, I think that's that covers the majority of what's in there. I mean, what are your thoughts? You're a fan of the president, so I assume that you're going to support most of these initiatives, right?
I have to dig into them too and kind of see, what the story is. But I mean, a lot of these things sound very infrastructure improvement, preparing for the future, rural broadband. You know, the VA EMR upgrade, I think, is going to be one of those things that we're going to see go round and round and round, because there's I mean, you know, this is a take out an EHR that is a legacy EHR that's working and put in Cerner, and that project seems to be struggling. We see regularly stops and starts and reboots and change of venues.
How many projects do you know that didn't struggle, that would wither under this kind of scrutiny?
Especially, you know, that size of a deployment, right? I mean, I deployed the first 2 different generations of electronic health records in the Department of Defense, and you know, it's it's healthcare. It's super complicated, and it's inside the federal government, which makes it even more complicated, filled with lots of additional regulations and like you said, oversight and politics around, you know, the whole procurement process and all of that too. So it is very complicated. I know it's not going to be easy to do, but yeah, I mean, I think continuing to make, you know, good investments in public health. Several of the items you read off were sort of public health modernization, which we sort of figured out over the course of the pandemic, especially in the early stages. Tons and tons of problems with public health, and the lack of investment at the local and state level over the past several years. And, you know, maybe we'll be able to catch up. But to your point, this isn't about just catching up. And, you know, in other conversations that you and I have had, this isn't about necessarily just catching up and building the things that we use today. This is about spending that money to build the things that we want to be in the future. And it's you know, we really have to sort of keep that in mind, because if we just build stuff that we already have, then we're not spending the money well.
Yeah, I'll tell you, this might surprise you. I have no problem with any of this. I really like the cybersecurity stuff. This is way past due. I think we need to this is one of the areas where I believe the federal government needs to take a leading role, and that is in cybersecurity. And not that I think they should, you know, usurp what, you know, private industry is doing, and the great security companies that we have that are advancing technology, but they need to think about it like they do national defense. And this 2.1 billion and a couple $100 million here and there is probably still not even enough. I'd like to see them really invest in that area. None of these really jump out at me. I do agree with you. We talked about this earlier. I did have a problem with all the money that went to health systems as a result of the pandemic, all the recovery money, and not because I didn't think it was necessary. I did think it was necessary. I just think it went, in a lot of cases, to the wrong places. It shored up balance sheets that didn't need to be shored up, and other balance sheets that were teetering are still teetering after the money got distributed. So I'm not sure that was well thought out. And I'm not going to call anybody out on that in terms of who took the money, who didn't take the money. HCA did not take the money, which is interesting. But I agree with you. You know, we need to leverage this funding to create the healthcare we want to see, not necessarily to support the healthcare that we've had in the past. And that's going to be the key. Oh my gosh, Drex, we're almost.
How long have we been going?
Well, let me ask you about this. So Mayo Clinic launched 2 new companies, and
I saw that.
Halamka's going to come on the show. Oh, by the way, do you say Halamka or Halamka?
Halamka.
That's what I say as well, but I heard him introduced at the CHIME event today as Halamka, and I thought, man, maybe I'm saying it wrong.
I've known him for years. I think I'm right, but
yeah, well, and he was a professor in one of the courses I took up at Harvard, and he introduced himself as Halamka. So I assume, unless he is changing the pronunciation, but it just comes up from time to time. So, head of the Mayo Clinic platform. I love what they're doing, by the way. So essentially what they're saying is we need a platform to support healthcare moving forward. And that platform has to be able to meet people in their homes and where they live, right? In motion. not necessarily only within the four walls of the health system. And that requires a certain level of technologies to be stood up so that we can collect the information from these diagnostic
Hospital at
devices
home. Yeah.
and in motion at work, feed that information into sophisticated algorithms that are AI enabled, ML enabled, machine learning enabled AI. I realize some people have gotten on my case. They're like, you realize you're being redundant. I realize that ML is a form of AI, but it's a very different form. But they're feeding it into there, which is helping them to respond to larger groups of the population, and only put that information that is really necessary, the insights, in front of the clinicians so that they don't have to wade through the mountains of information. And it's really interesting. So they're launching 2 new companies. I won't go into the details. I did go into it in Thursday's Today Show. 2 interesting companies, and I like the direction here. Here's my question for you. This is a tough one. I'll close you on a tough one, which is, do you see other health systems doing this level of forward-thinking movement to move into the home in this way? I know everybody has a hospital at home initiative, but this seems to me to be sprinting towards blue ocean, as they say, sprinting towards that area that really nobody else has really taken a hold of yet.
Yeah, no, I think John's, Mayo hired John because John, and I think he even said it today, something to the effect of, John is a builder, right? John is a maker of things, but only where things need to be made. What he's really good at, and what he's good at from my experience with him in Boston too, he's really good at putting together teams who look and understand problems and issues and challenges around the delivery of care, and how that delivery of care is changing for us, moving more and more to outpatient, more and more to home, and then figuring out how to solve those problems, kind of using a criteria of, is there something I can buy to do that? And if there is, then we should definitely buy. And if there's not something to buy, then maybe we partner with somebody to invent something to make that work. And if nobody wants to do that, then we have to build it ourselves. Right. And he has a platform. And I don't mean the Mayo platform, although that is what it is. He has a place that is willing to make investments to facilitate what in many ways is kind of the cutting edge thinking on how to deliver on this. And, I think he's the right guy. He's the right guy at the right place at the right time to make some pretty cool stuff happen. That could wind up being the standard that everybody else winds up following.
Yep, absolutely. Drex, I could hear your voice is already, starting to go after 2 days of just doing nothing but talking.
It's been a long couple of days. Yeah.
So I really appreciate you doing this.
And the sun's shining in Seattle, as you can see. So.
Wow.
I know.
Well, we should have covered that news story. The sun is shining in Florida as well. Not as much of a story.
Right.
As you would imagine. Hey, thanks again. It's always great talking to you.
Of course, same here. I'll talk to you soon.
What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.